Hello, dear colleagues. How are you? Rowan will do left carotid angiography. I should go outside from the operating room. Okay, I will be outside. Можно будет включить 3D. My name is Mynzhylky Berdikhojayev, and with my assistant Rowan Maratullah, we are from Presidential National Hospital, Almaty City, Kazakhstan. And review, да? Okay. Thank you. This is Presidential National Hospital. This is the artery coming from the aneurysm. It's a PCOM artery and the aneurysm. Patient with incidental aneurysm, on right PCOM segment, and right PCOM artery. This is classical Turkish anatomy. We discussed with Anularat from Ankara, and in ladies in Turkey, the ICA diameter usually 3.5 millimeter. In Kazakh ladies, the ICA diameter is usually more than 4 millimeter. Patient under local anesthesia. We started from angiography, then it was a little bit problem with this interventional tools. We restarted angiography 4 times, and now it is working. As this is the anatomy. Okay, Rowan made angiography in vertebral 3D. Yes, the aneurysm size is approximately 3.8 and 2.6 millimeter. And I see 387 this proximally, and 272 approximately 4 millimeter. Okay, review. And now Rowan made angiography for left carotid system. Yes, the lady is 49 years old. She's quite young with the headaches. That's why we recommended to treat her. And now we are planning to do balloon assist coiling for the PCOM aneurysm. At the end, might be we'll place the stent in the ICA. Let's see what we can do. This is the aneurysm, this is the aneurysm, but the working projection is here. Yes, this is the working projection. It's like on 3D. That's okay. Today operating nurse is Zoya, and second nurse is Akhil. And anesthesiology team, Lezat. And anesthesiology nurse is Lezat. Anesthesiologist usually coming when we do the general anesthesia. In cardiology practice, they're sitting in the control room from the beginning. I don't know why, but in neuro they decide to do like this. And video support today presented by Roman Povyshev. He's from Video and KZ company. And his boss, Evgeny Grishayev, now doing drone shows in one of the biggest cities in Kazakhstan. Okay. We have elections planned for the parliament in next 10 days, in next 2 weeks. That's why it's a part of the election campaign. Все, Роман, не свети. Okay, let's prepare this system. Yes. Our practice, we place the surah from Quran. The name of the surah is Baqarah. Анан почти 90 градусқа бұру керек болады. Okay, let's prepare the balloon. Balloon will be Eclipse double lumen. The guiding catheter is Klimber 8 French, which is coronary guiding, Judkins right, and short sheaths usually used for the entrance to the artery. Ибір система жалғай салындар тағы. Yes, Y connector in the working channel. Yes. Now we're flashing the balloon. And this is the Chikai black. Yes, and we're a little bit short from the material. We have limited number of instruments monthly. And it's a new reality in 2026. Okay. Yes, it's a local anesthesia. We are doing time to time, and usually it's okay. I hope it will be the same in this situation. Patient have very nice P1 segment. That's why no need to protect the PICOM. But here it looks like the PICOM artery is quite distal from the aneurysm neck. It's in aneurysmal segment, but it's not in the neck region. Okay, I took 60% contrast, 3 cc contrast and 2 cc saline, which is 60%. Now inflating the balloon, pushing the air bubbles from the dead space. Balloon is okay, balloon is not damaged. It's a first point we should check. And the second point, yes, balloon is fully inflated. Now we put the balloon inside the saline and deflating inside the saline, because it might suck some air from outside. Okay. Okay, let's take it out. As the balloon is Eclipse double lumen, and a guide wire for this case is Chikai black, and coiling catheter will be P-Novus, which is 17 and DMSO compatible. Yesterday we used the P-Novus for the Acero stent delivery, but it was very hard to push the Acero inside the micro catheter. Okay, 18 caudal, 13 caudal. Huh? Okay, right 27. This balloon is inside this guiding catheter. Now, round prepared. Okay, it's introducer sheath. First. And the micro catheter is 90 degree. I hope it will work. Yes. It's a little bit softer than gamma. Maybe a little bit. Okay. I think it's a little bit softer than headway 17, eh? Yes, okay. We have some issues with the headway this year. The registration expired, that's why it's not available widely. It's a tender system, that's why the old papers should be correct. Oops. Okay. The guiding now placed in the common carotid. Okay, I will push a little bit the guiding. Just a little bit. Okay. It's not so high. Yes, this is the aneurysm. Stop. Назад. Yes, usually the wire is going, no, not in this case. Wire is going inside the aneurysm, but in this case wire went in the MCA. It's okay, it's good. Yes, we can inflate a little bit. Yes, we can see the balloon, everything's okay. Usually Rene and the most of the colleagues doing it outside of the brain in cervical ICA, but usual practice, if I prepare the balloon, I usually confident about the preparation, but it's a human factor all the time. Okay. This is P-Novus catheter. As in a case of possible use of the flow diverter stands, we prefer to place the 8 French guiding. Also, sometimes it's necessary to place the Leo Plus stand after. That's why better to use 8 French guiding. It's possible to use 3 devices in parallel. Okay, now we'll place the pinholes in the aneurysm, and then we'll replace the Chikai black inside the... Okay, now it's inside. Usually it goes like this, it's a direction of the instrument. The first call we asked for Gecko. Gecko is a Tonbridge company. It's a Chinese manufacturer. But the Wallaby is also now located in China. Spinoz is a Phoenix Wallaby company. And it's only this is Teruma, Japan, this is Balt, France, this is Germany, China, and this is China. Okay. And Asahi wire is also from the Germany. Okay. Так, келесі спираль 2-де 4 аша беріңіз, Гекко. Итер. 2-де 4. The first coil is 3x6. I hope it will fit inside the aneurysm because it's not spherical, it's like a ellipse. That's all. Okay. The coil is coming. Okay, let's try to do it without inflation. Maybe it will stay inside the aneurysm. No, it will not stay. Yes, first of all, we place the coil inside the microcatheter and aneurysm. Then we will manipulate with the balloon. And patient has a ACOM. That's why it should be okay to inflate the balloon under anesthesia local. Okay. Now balloon is inflated, the anatomy is changed. Usually those steps are changing the anatomy. It's deflating. Okay. The flow is pushing. Yes, it's deflated. Now I will try to inflate again. Okay. Hope it will stay. Yes, anatomy is not one by one. That's why I should pull a little bit the microcatheter. Okay, now it's better. Okay, now it's better. Okay, now it's okay. Now we'll just detach it like an axiom coil. Bir жарымда 3, bir жарымда 4 ne var? Bir жарым 4 taş birisi. And the second coil is again Beko 2x4. Smoke mask. Maybe this one will be enough, huh? 1.5 maybe extra. Жарым сыймайды. Even this one looks like a bit. Жарым сыймайды. Жарым сыймайды. Quite самое крайнее. Плотно жатқан. Okay. Let's take out the microcatheter. And now we'll deflate the balloon. Okay, let's. Yes, it was look like a lot of space inside, but I think it's enough. Yes, it's enough. Yes, PCOM is patent. It's okay. It's possible to place the stand, but we can't follow. Yeah? Yes. Okay, let's follow. Чашка выросла. Now we'll do hijama. Yes, it's a very important step after taking out the whole instruments. Yes, anatomy is changed now. 50% сокровищный. Yes, everything is okay. We can take out guiding. Now I will ask Rowan to do XPCT. It's a part of the protocol. Так, мы аневризму уже закрыли, можете расслабиться, сейчас будет контрольное исследование, и на этом закончим. Хорошо? Там одна аневризма. Да, одна. Okay, let's wait. Okay, dear colleagues, the XPCT is ready. This is coil artifacts, and brain is clear. Okay, especially for my colleague and friend, my old friend Jose Cohen, the short review. The right PCOM segment aneurysm, this is PCOM artery, this is aneurysm. Incidental finding, patient had headaches and did MR, and on MR this aneurysm were found. It's more than 3 millimeter, that's why it's not an infundibulum, and the left side is clear. This is left side is clear, and the vertebral-basilar system is also clear. This is artery coming, and we took 8 French Klimber guiding catheter from Teruma, which is coronary guiding, and Judkins right with little bit modified by hand the tip of the guiding catheter, and then we placed Chicago Black with the Eclipse double lumen micro catheter, balloon catheter, and then inside the aneurysm we placed Pinovus micro catheter 17, and through the Pinovus we placed 2 coils, 3x6 and 2x4 Gecko complex coils from Tonbridge company. Also we had one more coil on the table, but the microcatheter at the end of the second coil went out from the aneurysm. It's a sign that there is no place for the coil number 3. We don't need complication, and usually in most of the cases the last coil might be extra, and we decided to finish the case like this. Yes, the segment might be diseased and it could be indication for the stenting, but thanks to complex economical situation in my country, we should think about the saving money, and maybe it's also better for the patient. It's our experience from the beginning. If it's possible to do it with balloon assist coiling, then the second session usually necessary for 10% of our patients. It's not 100% of stenting, it's just the 10% of stenting. And I hope this patient will be stable. We will follow and we'll see. It was under local anesthesia, no intubation tube, no IV propofol, just lidocaine in puncture, and CT was clear. Everything is okay. Now we finished this case, and the next case will be ICA aneurysm. Thank you for watching. See you in next 30 minutes.